Okay, we'll have a moment of silent meditation, pledge to the flag. I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right. We'll call this meeting of the Monongalia County Commission to order. It's April 30th, 2025, about 10 a.m. Joined by Commissioner Sikora and our Office Manager Colleen Kuhn filling in for Renetta. So we will start with our consent and approval with Colleen. Good morning.
Good morning. There are 18 exoneration listings for $4,242.45. Minutes for April 23rd, 2025. Vouchers, General County, $368,897.27. 911, $236. Chestnut Ridge Park, $4,499.84. Camp Muffley, $1,558.83. Mason-Dixon Park, $884.32. Mon County Center, $307.27. Opioid Settlement Funds, $19,781.11. Assessor's Valuation, $380. Purchasing card vouchers, General County, $25,248.70. Mason-Dixon Park, $1,053.94. Assessor's Valuation, $95.45 for a voucher total of $422,942.73. There are no budget revisions. Position vacancies for boards and authorities are listed on our website, and fiduciary orders for April 30th, 2025.
Move to approve the consent agenda items as presented.
I'll second. All in favor?
Aye.
We had an additional fiduciary item. Let me pull it up here real quick. An objection to a claim in the estate of Beverly Short. Had some correspondence from the administrator who objected to the claim based on needing some more time for insurance to process the claim. So how do you want to proceed, Sean?
Okay, so rather than taking any action on this, I would just recommend that we give them a set amount of time to let the claim process through the system and see if the insurance company will pay it, and then if not, then the state will need to take care of it, correct?
So 90 days, okay.
That's fine with me. I'll go ahead and make that motion. Make the motion that we give the estate 90 days for the creditor claim to process through insurance before revisiting this.
Good. I'll second. All in favor?
Aye.
Aye. Next, we got the introduction of new employees, personnel changes. First, the sheriff's office. We've got Brian McCullough, and then John Ryan. Aaron, we'll call him.
Good morning.
Look at this John guy.
Yes, we're asking for the approval of appointment for Ryan McCullough as a full-time transport officer, effective May 1st. It's benefit eligible, and it was an advertised position. The salary is $3,140.54 per month.
Great.
Go ahead. You do it.
Okay,
We'll just do
and
both.
the appointment of John Aaron Ryan as a full-time home confinement officer, also effective May 1st, as well benefits eligible, and it was an advertised position. Salary would be $3,275 per month.
I move that we approve the positions as presented.
A second, all in favor?
Aye.
Congratulations.
Welcome to the county.
I've known Aaron
Good seeing
since
you.
grade school, so good to see you.
Good seeing
Glad to
you.
have you
Thank
back around, and look forward
Too.
to
I've
working
known
with
him
you.
for a long time. It's been a long time, but good seeing you. You look good.
Thank you. Thank you.
Sorry, Ryan, don't know you, but welcome to the county. And,
Welcome to the county.
Good luck on your position. We appreciate it.
Thank you.
We have Youth Services Center. Next, we have Sarah Dunn, Youth Crisis Worker, transfer to full-time.
Yes. So her salary will be $33,280, and she will be starting this position on May 1st.
Move that we approve the personnel as presented.
I'll second. All in favor?
Aye.
Next, CASA for Kids, we have two. Kayla Record, volunteer supervisor, full-time, and Sierra Watkins, volunteer supervisor, full-time.
Yes, so they're both also starting on May 1st, and their salary is $39,000.
Move that we approve the personnel as presented.
I'll second. All in favor?
Aye.
Next, we have comments from the public. At this time, this is our public comment section. We'll open it up. Anyone's welcome to come forward and state your piece, as it were. 2 to 3 minutes to speak, and I will open that up. Do we have anyone that wants to speak? No, I recognize all the faces, and nobody's general public today, so with that, I'll close comments from the public. Next, we have Colleen Kuhn, grants.
I do not have any grants today, but I do have an announcement. We are going to be opening up the County Opioid Settlement Fund grant application on May 2nd. Those will
Okay.
be available. The close date will be May 23rd. Everybody who applied previously will receive a notification, and if there are any agencies that want to apply for it, they just need to contact the office, and I'll get them that information.
Okay, and this is separate from our grant funding that we completed in March.
Yes, sir.
And this, the information is on our website and the portal. The link to the portal is there as well.
It will be there as well.
It will be posted there by the time.
Okay, and I'm sorry, you said the opening would be the 2nd of May?
May 2nd, yeah.
Okay,
Great.
perfect.
Next up, correspondence. First, we have letters of support provided for the City of Westover Railway Streetscape Project and Mon Health Medical Center. These are the requests that came in for congressional or senatorial directed spending that we signed off on letters of support for. We have copies of those if anyone would like to see. Next, we have tax increment financing application for the City of Morgantown Redevelopment District Number 2 regarding the proposed amendment to the Riverfront Project Number 1. Any comments on that, or just kind
Yeah,
of?
they're just copying us, so.
Yeah, okay. No action to take, of course, it's correspondence. So request for funding assistance from Robin Addy, Affiliated Director for the West Virginia Future Problem Solving Program for 17 Monongalia County students to attend the Future Problem Solving International Conference in June of 2025.
I recommend we forward that to a staff report so that we can discuss it and decide on a path forward.
Sounds good. Seeing no unfinished business, move on to new business. First, to consider on first reading a proposed amendment to the ordinance creating the Monongalia County Planning Commission to amend Article 5, Section 1.
I move that we approve the reading as presented.
Second, I guess we'd read it, or?
No, that, you read it. The title
Okay.
is adequate.
Okay, all in favor?
Aye.
Aye.
And just a little background, this is, the only thing that's changing in here is there's one sentence that's being removed from the ordinance, and that sentence being, one planning member shall be appointed from each planning district, so we're removing that requirement. The schedule for this is, the announcement and setting of dates was last week. The published notices will go out on the 30th and the 9th. The first reading is today. The second reading and public hearing will be the 14th. And we have the ordinance as currently, as suggested, on file if anybody wants to see it.
And we have a great number of applicants for the planning commission, so we were waiting until we took this action to see whether or not this went through before we made any decisions on those
Yeah,
applications.
so once we get this out of the way, then there will be a lot more availability as far as, or opportunity in regards to serving on the planning commission.
Great. Next, consideration of proposal received by the county commission from the West Virginia Communities Risk Pool for the county's general liability and workers' compensation insurance with the effective date of July 1, 2025.
I move that we approve the proposals from the West Virginia Community Risk Pool for the county's general liability and workers' compensation insurance as presented.
I will second. Any
The-
discussion?
There's an increase. It's about a 5.5% increase. After the credits, it's about 4.2. But actually, our rates went down this year, but our exposure went up. So
Okay.
like we have a heavier payroll. So our
Right.
payroll went up like 13% with law enforcement, which is And then the overall payroll went up about 7%. So the rates went down, but the actual
More
things that are
employees.
covered, property went up. We had a lot more vehicles. I think there was 106 versus 116. The overall value of the property went up. So that's why we're seeing an increase from the risk pools perspective, as was reported in our last meeting, that we would see some of the liability insurance was going up, but some of the workers' comp was going down. So we were expecting a small increase, about 2%, but the difference is the exposure.
More
grows.
employees, more
Yeah.
things to insure, the higher the insurance.
So we're still, as always, we're very satisfied with this product from the West Virginia Risk Corp. And it was one of the best decisions we ever made, switching our insurance over to them, because it's really been, in terms of the actual product and the service we receive, there's no comparison.
Great. We had a first and second, all in favor?
Aye.
Aye. Point of order, Colleen, did we vote on the planning commission
I do.
reading?
I believe you did, yeah.
Yeah.
Okay, I think I took the discussion out of order as well. Got myself
Yeah, we did it,
confused.
and then
Okay.
we had the discussion.
Okay.
I just wanted to give a little bit of information to the public.
Making sure. Next, consideration to approve master service agreement and associated documents with Enterprise Fleet Management in response to RFP number 2025 MCC 001.
Yeah, so I want to provide a little bit of description before we
Sure.
before we take a vote. So this RFP was released on the 12th. We had a pre-bid on the 12th of February. We had a pre-bid on February 27th. Responses were due back 3/19. We received one response from Enterprise Fleet Management. Their technical response still needed to be evaluated to determine that they were responsive to the RFP. And I reported back at the meeting on the 9th that we determined them to be technically responsive, and asked for approval of the commission to go ahead and move on through cost evaluation and possible negotiation. So we went through the cost evaluation, and their cost proposal was deemed to be reasonable. The pricing that they provided is pretty much in line with where we are now with our current fleet management. So we went ahead and went forward with what's the next steps. The administrator and I met with them last week and got to the actual agreements that we have in front of us today. So there's a number of agreements. We're going to approve these agreements as we get them filled out, like
Right.
there's a credit app, then the president will be called on to sign those. But what I want to do is get approval for the actual entering into the agreement. So the actual documents for approval is a master equity lease agreement for government entities, maintenance management and fleet rental agreement, EFM government credit application, authorized signer agreement, consignment auction agreement for sale of customer-owned vehicles, assignment agreement to sell customer vehicles, and a Sourcewell contract authorization letter. So all those will be provided to the president, and I would motion that we approve the president signing the enterprise fleet management documents as discussed.
I will second. All in favor?
Aye.
Aye. Next, consideration of an amendment and restatement of lease with the Monongalia County Development Authority for the Wards Building and related documents thereto.
Okay, so this one has a little bit of a storyboard to it.
Yes, it does.
In December 28th, 2016, so that was actually like a week before I came on commission, commission signed a 20-year term lease purchase agreement with the Development Authority. It gave them a 5-year grace period to start paying, but the purchase price, the building was valued at $1.5 million without the the basement floor and the fourth floor, and the purchase price was $500,000. So they gave them 5 years to start paying $500,000 down on that, and they were supposed to make yearly installments. The commission still has the the basement and fourth floor for storage, and we have that in perpetuity. Fast forward 9 years, the Development Authority is cash strapped. The elevator broke and needs to be replaced. Our major tenants on the third floor, and most of the people who use the elevator go to the third floor, and I appreciate the Public Defender's Office being very patient with us, because we were trying to figure out what it was actually going to cost and how we are going to actually come up with the funds to actually fix it. As you're aware, the Development Authority is pretty cash strapped due to the Richwood agreement, and once that agreement goes forward, then they eventually in the next year should enter into a normal financial operating cadence, but they didn't have funds for the elevator.
Sure.
And part of that, I mean, and there's also a main water line that they've done a fix for. They did about a $9,000 fix, but it's a main line and it needs a more permanent repair, and that's about a $30,000 fix. And obviously didn't have money for that either. So we were having multiple discussions, and again, our employees go to the basement, go to the fourth floor, so we actually still utilize the building too. So Commission, being a partner, had talked about ways that we can get through this. So what we have in front of us is a number of documents that we Commission gave a number of objectives to the Development Authority. If we were to grant them the dollars to fix this stuff, how we wanted to see a few things restructured. And we wanted the lease purchase agreement restructured. We wanted to make sure that MAP's presence in the building was formalized. So the documents that we have in front of us is a grant agreement. First, the grant agreement gives us the authority to give the Development Authority $500,000. That $500,000 is broken down by $370 for the two fixes, for the replace the elevator, for the water line, and the other $130 is for their dues to MAP for fiscal year '26. And then there's the First Amendment restatement of lease purchase agreement. So it actually calls for the $370 to be used for those repairs, ensures that MAP has a right, but not has the right, but not the obligation to continue to rent the second floor at the same terms and conditions as they currently exist. Restates the requirement to obtain a payment in lieu of taxes from non-government renters and enforcement of facilitation agreement. We put that was in the original agreement, and they have been collecting, but they haven't been, we don't have a formal agreement in place that will facilitate the payment to the county. So that was a long-standing thing that we needed to get done. So that will also be done in regards to this. Let me see, where did I leave off? Payment purchase price is now adjusted to $1 million. And if the Development Authority should ever exercise their option to purchase, they would enter into a lease with the county for the basement and the fourth floor at an annual rent of $1 for a period of performance of 50 years with an option to extend for 20 years. Then there's a lease to MAP. If they were ever choose to exercise the option, then there's a provision in there they would have to give MAP a lease under the current terms. Let me see what else. And if they desire to sell the building, it incorporates a right of first refusal for MAP to be given a chance to purchase the building if they so desire. And then the last thing is it incorporates a assignment of rents and leases and rents. So if they were to go into default, then the rents that come in from the existing tenants would come directly to the county to make sure that our obligations are covered. So that every payments would start July 1, 2025. So we pushed the period of performance out for 20 years. So they have 20 years to pay it back, $50,000 a year for the next 20 years, and they start paying on 7/1. So that's kind of the gist of the whole
Great.
thing. Russ, did I miss anything? Did you want to say anything?
No, I always like to say something.
It's getting into stop is the key.
No, I think the key here is, when that building was first turned over to the Development Authority, I want people to understand how successful that building has been. Development Authority's put, some $500,000-700,000 into the building. It is fully leased. And so overall, I think that building's been a huge success, and in large part, thanks to you all. The original agreement made that possible, and we really appreciate the fact that you're willing to step up and continue to be these strong partners to development and provide a solution and a scenario that I hope you believe is fair to all, because we still have that great asset. A functional elevator is critical to a 5-story building, basically, and but without your cooperation, we wouldn't be able to claim that building will be in good stead, both mechanically and being able to continue to be a good provider of office space for individuals and groups moving forward. And under normal circumstances, the building does cash flow, which is another huge positive aspect of it. So, but again, I just want to sincere thank you from both the Development Authority side, but also the partnership side, and being great partners in development, and particularly here in the downtown area.
Great, thank you. So I move that we approve the president signing the agreement documents between the Monongalia County Commission and the Monongalia County Development Authority as discussed.
I will second. All in favor?
Aye.
Aye. Moving on, reports from elected officials and department heads. Anyone? Mayor Lewis?
Good morning.
Good morning.
Patricia Lewis, Town of Granville. Just a small update on our traffic light project. We have, it's about 95% complete. We have a programming issue that our contractor was made aware of today. We have a couple housekeeping items that need to be cleaned up. One is some landscaping that was disturbed during construction that we need to make sure is back in order. And we're still working on some of the thermoplastic markings that were put down on the pavement. There's one area where it didn't hold like it should have. So then that project will be complete.
Okay,
Great.
thank you, Mayor.
I believe Forest Wine's coming up. Morning.
Forrest.
Morning, thank you, Commission. Forrest Line with Mon EMS. If you read the great coverage that we had this past week from Benton County Dominion Post and VOI, Mon EMS has an announcement starting tomorrow about our whole blood program, and I wanted to bring Dr. Robbie May, who's our Director of Clinical Services, to give you all a quick update. So,
Okay,
Great.
welcome.
Good morning. So I'm excited to share with the Commission as well as the citizens of Mon County. We thank the Dominion Post for their help with that. That as of tomorrow, we will be live with whole blood for patients in the county as well as ambulance services that are coming into the county who may need that resource. We're one of less than 100 fire or EMS agencies in the entire country that have whole blood, and we are the third in the state and the most populous in the state. But I think what really makes Mon County stand out is that a lot of places, the traditional model is to just train supervising paramedics to administer the whole blood. We made the decision to train not only all of our paramedics, but also the paramedics with Morgantown Fire Department as well. And then we did additional training, even though the EMTs can't give it, we did additional training with all the EMTs but between both departments so that they're aware, know when to call for it, etc. So starting tomorrow morning, we will have that service. We have seen clear data from across the country that even when you have a state-of-the-art level 1 trauma center right in your backyard, people have about 30 minutes if they're having a hemorrhage until death. And so it's really something that they need in the field. And I can tell you from previous experience before I came to Mon EMS, with a service that had blood, patients that in my 23 years in EMS never would have seen the actual hospital are making it now because we can deliver this treatment right into the field. So we're super thankful to WVU, who is providing the blood for us to actually give to patients. But we're very excited to launch this, and so we want to make sure we shared that with you all this morning.
Great. It's fantastic.
What exactly, and I'm sorry if this is a stupid question, but what is a whole blood program?
Yeah, sure. So what it means is that we are carrying a unit of whole blood. And so what whole blood is it's all the components that you have in blood. For a long time in medicine, they took the blood apart and broke it into three components: the red blood cells, the plasma, and the platelets. But what we've realized over research over the last about 20 years, especially, trauma care has really advanced because unfortunately / fortunately, the wars in Iraq and Afghanistan. And one of the things that came out of that was how much whole blood could really save someone's life. So it has the red blood cells, it has the platelets, it has the plasma. So basically get oxygen to all your cells, and then the platelets to help you clot from wherever you're hemorrhaging. And then specifically we give O positive because O is the universal donor. And the vast majority of people in the United States are Rh positive. But it doesn't matter, like, for example, if you're A negative or B negative, it doesn't matter if you get positive blood. The risk of a reaction to O positive blood is 1 in 40,000 patients. And I can tell you from the Maryland EMS system, which I'm most familiar with, over the last 3 years that they've been delivering whole blood, there's been no reactions across the state. So it's incredibly safe.
So it's just on the, you're just having it on the vehicles?
So it's on our supervisor vehicle.
Okay.
So blood is a limited commodity, as you probably see, with the Red Cross and other agencies asking for people to donate. So we're able to get 1 unit at a time, and generally that's what a patient needs. It's very rare in the field that a patient needs a second unit of blood. So WU gives us a unit of blood. We recirculate it with them once a week to make sure that it doesn't go bad, that if we don't end up using it, they can use it on a patient in the hospital. Because you have about a month once the blood's been donated to use it before it expires. But it's on our captain's vehicle, which is stationed just over here by Mon Health. And then dispatch, as well as all of our clinicians, are trained to know that if the 911 caller, if this seems like a case where blood may be needed, or our EMS clinicians get on scene and say, hey, blood's needed, then they'll dispatch that supervisor to meet that ambulance.
Great. Thank you.
Awesome.
Fantastic. Great,
Learn
guys.
something
Thank
new
you.
every day.
Any other, I saw Alex back there, no? Any other elected officials or department heads? Nope. Moving on, reports from county commissioners. Sean?
Since our last meeting, last Wednesday afternoon, we had our Chaplain Hill project call, and those calls are very brief, but they're very informative, and they're very, they're moving the project along. Little baby steps, but they're moving the project along. And that's for the Exit 155
Right.
project. On Thursday, I was invited to go see or participate in Lauren's Law signing, and then in the evening, we had the MAP annual dinner. On Friday, the administrator and I had a meeting with USI and Enterprise Fleet Management, as I indicated earlier. This week, this Wednesday is a regular day, no work sessions, but we have our Chaplain Hill call this afternoon. Tomorrow, the administrator and I have a webinar with USI and another consultant. Friday, we have staff reports, and I have a local broadband tag up, and that's really all I had. I really want to thank Russ for your help in finally getting this Development Authority agreement through, and I want to thank our legal counsel, Tom Rubenstein and Byron Collier with Dinsmore and Scholl, and Rocky Gianola with Louis Gianola. He's the other side, the Development Authority lawyer, and all three of them working together to really pull this together in a quick time frame. It was approved by the board. The substance was approved by the Development Authority board in our last meeting, and we wanted to get this done as soon as possible so that Russ can move on with the elevator repair. I believe you guys have bids in.
Great.
The bids require, because you're buying a new elevator, bids require a certain amount of payment up front. So we needed to make this happen pretty quickly. So Russ, if you have that invoice, we'll take it. But thanks for all your help, and that's all I have.
I just have a couple things. On Monday, I completed the signing of the transaction whereby we released the lease that we had at the prior 911 building. So that could facilitate the transfer of that building to Mon Health, and in turn the building commission completed the second half where the property that we're taking over and a swap for that property took place at the same time. So that should be recorded and taken care of this week. But I completed our half of it with Reeder and Schumann on Monday. So other than that, I don't have anything else. So
We'll move to adjourn.
second, we are adjourned.